interventions. The presentation is targeted to program staff and will focus on practical, cost-effective, and simple ways to provide such interventions. We will also help webinar participants identify possible uses of mobile health in their programs. Following the presentation, we'll have time for Q&A, so don't worry about that, and I know Kathy will be talking to you a little more about that. Quick introduction of our speaker, Dr. Christopher Branson is a clinician and researcher at St. Luke's Roosevelt Hospital and an assistant professor of clinical psychology at Columbia University's Medical School in New York City. His work focuses primarily on adolescents with co-occurring disorders, traumatic stress, and juvenile offenders. Dr. Branson has provided mental health and substance abuse services for youth and adults in mobile crisis, outpatient, day treatment, and inpatient settings. He has served as a co-investigator, evaluator, or site PI for 3 SAMHSA grants, both with CSAT and CMHS, and has published studies on substance use, HIV prevention, and mobile health interventions. So without further ado, I'll turn it over to Kathy, but I do want to again thank Dr. Branson, and I'm really looking forward to this discussion and hearing what he has to say because it's a very important and timely topic. So, okay, Kathy, go ahead.
Thank you, Linda. Just before we get started, I just wanted to go over 2 things. One, we'll have Dr. Branson present, and then at the end of the presentation, we will be able to take your questions in 2 separate ways. If you look to the right and you look at your the open dialog box on the right, you will see on the left side something that says raise hand. If you click that, we will be notified that you have raised your hand and have a question, and we'll be able to unmute your line for you to ask that question. At the very bottom of that dialog box, you will be able to see that you can write in a question. All you would need to do is where it says send to, there's a drop-down menu. You would put host, you would select host, and then type in your question and hit send, and that will come to us as well. And we will open the line to have that question asked. If you can just let us know who is asking the question so that we can announce that. All righty, well, thank you very much, and thank you, Dr. Branson. And we're going to switch over to Dr. Branson and put up his PowerPoint for him. There we go.
All right. Well,
Dr. Branson, thank you so much.
No problem, and thank you for the invitation and the nice introduction. So hi, y'all. Y'all can feel free to call me Chris. No need for formalities. And like they said in the introduction, we're going to be talking about how to use mobile phones to improve services that you provide. So I'm going to cover all the topics mentioned in the introduction, but one thing I want to emphasize is that I really want to make this applicable to your programs and really just think of simple, practical ways that you can start using mobile health in your programs. And so I'm going to try to target it toward y'all and not make it so researchy. One other thing, towards the end of the presentation, I'm going to ask y'all to come up with ideas for how you could use mobile health in your program, and we can think through, ways to accomplish that, what might be some barriers, how to get started. So I'd like everyone to start thinking about that and try to come up with ideas during the presentation, and I hope to hear from everyone, or at least most of y'all, so please don't be shy. And before I jump in, are there any other topics besides the ones listed here that anyone would like to cover today? All right. Well, if you come up with any questions or anything, again, feel free to, type them in. You don't have to wait to the end. All right. So let's move on. All right. So before we talk about the uses of mobile phones, I just want to quickly define mobile health. It's a fairly new term, and it really just means the practice of medical, mental, public health services supported by mobile devices like cell phones, PDAs. So why should we consider using cell phones? I think one important reason is to improve access to treatment. We all know that there's more demand than available services. SAMHSA's, National Survey on Drug Use and Health tells us year after year that 90% of people who need substance abuse and mental health treatment don't receive it. And by using cell phones to improve treatment and improve outcomes, we get people out of treatment sooner, we get more people off of wait lists, and we can also use mobile phone-based interventions to treat more people, since a lot of our programs can't expand their capacity and we really don't have any more room for new clients, patients. A second reason is to increase, client acceptance or satisfaction with treatment. So, we may all love doing, in-person treatment, but a lot of clients, especially teenagers, dislike coming to an office every week. And I think this is one of the big barriers to keeping clients engaged in continuing care or post-treatment after they, especially in substance abuse, they come to treatment and then they're just kind of done. And then what happens when clients don't get some kind of continuing care, ongoing support? Well, we all know they often relapse if they're ever absent in the first place, or they return to pre-treatment levels of use or, psychological distress, and it often takes a while to get them back into treatment. So text message and phone-based continuing care can work, and for a lot of people it's more convenient. They don't want to keep coming, to our programs week after week for an extended period of time. And then another reason would be, talk therapy isn't for everyone. There are a lot of people that prefer self-help programs or, talking to non-professionals, and there are some great cell phone and web-based self-help programs for tobacco, other substances. So we're going to touch on some of these a little bit later. But bottom line, I think it's a way to engage people who may never come to in-person treatment no matter what kind of outreach we do. A third reason would be to enhance the treatment we already deliver. So in case some of you are getting nervous that I want to replace you with automated cell phones or have you hunched over texting your clients all day instead of seeing them in person, that's definitely not the case. Again, I just think cell phone-based interventions can enhance what we already do. They can improve engagement or adherence, and they can help them facilitate real-world practice of skills they learn in therapy, or even provide real-time support. So we'll get into examples of some of these a little later on. Next, I think the most obvious reason for considering cell phones is people love their phones. I guarantee every one of you has a cell phone in your pocket right now, and based on surveys of adults and teens in the U.S., 88% of adults own phones and 75% of teens. And the majority of people own cell phones across every racial, ethnic group, and social class. So rates of cell phone ownership do go down with lower income, but it's still greater than 50% at all income levels. And, as someone who works primarily with teenagers, I also find that the majority of them prefer texting over phone calls. So if they're running late, I'll call them to find out what's going on. They almost never answer. But if I text them, they get back to me instantaneously. And there's also research showing that both teens and adults in mental health and substance use treatment are open to using cell phones and texting to communicate with their therapists. Last, it doesn't cost much. A majority of people already have phones, so you don't have to spend money on fancy new, mobile devices or PDAs or equipment. And, I work predominantly with lower income youth and families, and so my interest is always in developing interventions that are accessible across social class. So there are lots of fancy new, iPhone and Android apps coming out, but I'm less interested in those because a lot of my clients don't have smartphones. So I'll be focusing on kind of real practical things that you can do on almost any cell phone. All right. So I've told you the good news so far, but as with any new idea or field, there's always barriers, potential downsides. So one of the big ones is HIPAA and privacy concerns. So I believe that you'll be attending another webinar presentation with David Smith, and he really goes in depth about this topic and knows much more than I do. But I will say that one of the problems is that the government and professional ethical guidelines are still figuring out, how to address mobile health interventions and make them HIPAA compliant. And there are lots of companies that advertise, HIPAA compliant software for sending large batches of text messages. But I've learned that this is actually a false claim, since there really aren't clear guidelines about how text messaging can be HIPAA compliant. So we're going to talk about some basic ways to deal with this issue a little later on. Let's see. The next one is concerns that text message-based interventions are less effective than in-person treatment. So this really applies more to interventions delivered solely or primarily by cell phone or texting. I will say that in-person treatment services, they're only effective if the person shows. So I think it's useful to use mobile health to target or engage clients that refuse to come, or maybe they're not adherent with treatment, or they're not really benefiting from in-person treatment. So I'm not saying all treatment should be delivered this way, but there are ways to use it just to improve what we're already doing. Another question that some have is, do clients even want this? The short answer for the most part seems to be yes. The literature on these different kinds of interventions, for the most part, clients rate them positively, seem to really like them. I know that the few interventions I've tried at my hospital, the teens absolutely love them and want to find more ways to use cell phones. Still need more research, but so far it seems like clients are interested. Now, for programs that are looking to start using mobile health, a natural concern is, wondering if such interventions are too expensive or they're too complex, and it doesn't have to be. So later on, like I said, we're going to brainstorm ways you can start using this in your programs, and I'm going to focus on low-cost, easy-to-do strategies, since many of us don't have on-site technology experts or IT departments, or maybe even the funding to do something really complex. So, again, we'll talk about ways that you can do this with just a cheap pay-as-you-go cell phone. Now, one other concern is, wondering if this is safe. We've probably all seen stories in, TV or on the news about cell phone addiction and, people texting while walking or driving and getting into accidents, or exhausted teens who keep their phones under their pillows and text all night, or even just cell phone and, internet addiction. So I think it's natural to ask, like with any new intervention, is this safe, or are we, increasing overuse or dependence on cell phones and texting? The short answer is we really don't know. There really hasn't been much research on this in the U.S. There's been a little bit in Asia on cell phone and internet addiction, but not a lot. So we definitely need more research in this area. All right. So let's talk about some examples of what's already been done. So most of the original mobile health interventions were really designed, in the medical field to manage chronic health conditions like diabetes, asthma, and HIV, which I'm sure, some of your clients have in addition to mental health and substance use issues. So those kind of interventions might be useful depending on the population you serve. I first got interested in mobile health as a way to improve treatment engagement and adherence. So if your programs are like the one I work in, I bet that missed appointments, no-shows, are a pretty major barrier to treatment. And as a clinician, they're frustrating and they waste time, which we don't have a lot of. So I found that doing phone call reminders, a lot of clients didn't have voicemail set up, or they wouldn't check their messages, or, I'd have to call at an appropriate time, but I might be busy all day with clients. So we and some other researchers at other institutes as well have pilot tested the use of appointment reminders. And here we just simply sent a reminder the night before to clients, and it simply said, see you Wednesday at 4. And in our study, and also in a huge study in the UK with adults, we found that simply sending text message reminders improved attendance, by up to 33%. So in our clinic, in the study I did, we increased it from 49% attendance for no reminders to 64% just by sending a reminder. So that seems like a pretty time and cost-effective intervention if you can improve attendance, generate more revenue, and then clients hopefully will get, they'll come in more often, and then they'll get better more quickly. And now I find I actually use it with my clients. And so if my clients or their parents, are running late, they'll text me and let me know, or they'll cancel if they need to, and then, it saves me from just wasting time waiting around on them. So far it's been really helpful. We're trying to look into ways to expand it across our psychiatry department. Another way to use that mobile health has been used is to enhance or improve the in-person treatment we're already providing. So one intervention looked at text messaging to provide booster sessions. So they had adolescents attend a HIV prevention program, and sometimes we'd like to bring them back in months down the road for booster sessions, but we may lose track of them, they may not be interested. So now researchers are experimenting with just sending reminders about the information or supportive messages via text messaging. And so far, the small pilot studies they've done, adolescents really like it. They need to do outcome studies to see how it works, but it seems like a great idea. Another way is to improve, like CBT treatment. So one study we're doing right now, we find with adolescents a lot of times we'll give them CBT homework to complete in between sessions, like mood diaries or tracking their stress levels, things like that. And the majority of the time, at least in our program, teens forget it, or they fill it out and leave it at home. They just don't do it at all. They don't want to do it. So we're experimenting with just having them complete the homework by text messaging. So we'd send them the questions each night. We started real simple, like what's your stress level, your mood, and they text back. And so far we found that teens like it, they're willing to do it, and they complete the majority of their homework by texting. There's another study with adults in CBT treatment, and they did something more advanced. They tracked a lot of things by text messaging, stressors, positive activities, coping skills used, a lot of different things. And they found that doing this with, low-income adults, they had great compliance, and the adults rated these interventions really highly. So that's just a simple way that we can improve what we're already doing in treatment. Some other things that have been done to enhance therapy, CBT or otherwise. In one example, a therapist recorded, scripts for progressive muscle relaxation on a client's cell phone. So then if they were on, the bus or, riding in the car, whatever they were doing, they could listen to this personalized muscle relaxation message. So that helps them, I think, practice it and hopefully, learn the skill more quickly. Another example I read about that I thought was pretty creative, there was a client who was going to CBT, developing insight, but, had trouble remembering, like, what coping skills to use in the moment. So she and her therapist wrote all this stuff down on a dry erase board in the therapist's office, and then the client just took a picture of it on her cell phone. And so then whenever she was out in public and, she got triggered and she couldn't think of what coping skill to use, she could just pull up the picture on her cell phone as a reminder. So I think that, those are really simple ways, and I think there's a lot of other, ways to use those, use cell phones like that, and we'll talk about some in a little bit. And then similar, using cell phones to support use of coping skills learned in treatments, like the example I just gave. Other possibilities could be, I use a lot of imagery with my clients. If you're thinking about using substances, what's a powerful image, that will remind you not to do that. So I have clients who don't want to use because they want to be a good example, good role model for a younger sibling. So what if they took a picture of their brother or sister, just to remind them, or even had them holding up a sign like, don't do it or whatever. Just, I think, simple ways to help, remind them and, keep them motivated when they're out in the real world. All right. Now let's talk about some substance use interventions. So there's a great, web-based program for adolescents, young adults, where they go online and, complete a web-based assessment. And then based on the results of that, they receive tailored text messages, at certain times of day, like when they have the most cravings, to support their use of quitting smoking, and that's been found to be successful. Also, in terms of substance use interventions, there's a recent study. This one's a little more complex. It would be hard to do without outside help to set up. But they did it with young adults in the emergency room, and, anyone who was assessed as, having risky drinking, binge drinking, they asked them to sign up for this program. And basically for 12 weeks, each week they received an automated text message asking, how much you drank last time. If it was, binge drinking, then they'd ask them, they'd provide them feedback on that, ask if they'd be willing to try to cut down the next time they drink. If the client agreed, then they'd send them tips for how to do that. And it was shown to dramatically reduce rates of binge drinking just from automated text messages with no one on the other end. one site I want to highlight for you where you could do something similar, and maybe we can get someone to send you this, or I can tell you the address right now. It's healthtexts.com. This was developed by a colleague of mine. I don't make any money off it or anything like that. And he has a web-based program that is free for clinicians and programs to use, and he does consultation. And there's a couple ways you can use this. Basically, it also provides, text message-based interventions for people for a variety of issues, substance use, smoking cessation, general motivation, stress reduction, gambling are just a few examples. And so, you as clinicians or even your clients themselves can go up to the website, and they can either use messages that have been developed by professionals based on motivational interviewing and, the literature, or they can create their own tailored text messages, and they can get them at random times of day or specific times when they might have strong cravings or, particularly stressful times of day. And like I said, it's absolutely free. It can be used as a standalone treatment. It can be used as continuing care or an adjunct to office-based treatment, and it's absolutely free. So I, recommend that y'all look into that because a lot of the work's already been done for you. A couple other interventions I want to mention. Like I said earlier, we know that when clients complete treatment, often it's hard to get them engaged in some kind of continuing care, 12 steps, relapse prevention groups, whatever it is. So there's a couple things that have been done. One is telephone-based continuing care, in which you just have 15-minute phone calls, a couple times a month. You have more calls at first, and then, it tapers down over time. And they've found that for alcohol use in adolescents, it's just as effective as in-person 60-minute relapse prevention groups, and it's, much more effective than no kind of continuing care or post-treatment. And so that's something, you could easily do now. Just start checking in with clients by phone. And like I said, 15-minute phone call has been shown to be effective. Let's see. Also, you can do things like that by text messaging, and they've shown that the phone call continuing care is effective whether it's done by professionals or by peers. So that's another thing to consider. All right, so those are some of the interventions that have been done. Here are other potential uses that either I've thought of, colleagues have told me of, and then we're going to get into ways that you could use cell phones in your programs. So one example that I heard from a colleague is just using cell phone games or music, to distract yourself. So, I'm in New York, so if we're on the subway, we have clients who maybe they get really anxious, they don't like the crowded subway, and then just using those games that we already played to distract themselves. Or again, listening to like a relaxation message from your therapist or maybe some other, message you recorded for yourself. We did appointment text message reminders, but I think it could also be done for intake. I think it's been done with, medication, HIV medication. It could be done for psychotropic medication, since we know there's often, low rates of adherence with that, which can affect treatment. Again, other ways to facilitate use of skills learned in treatment, whether it's just reminding clients, sending them periodic text messages that are supportive or, remind them of skills they can use to cope. Like we talked about, it can be used for continuing care for substance use, chronic mental health issues. There's, been some work, but I think there's a lot more ways we could do this. Crisis intervention for high-risk clients. There's some apps that, if a client dials in, it hooks them up. Hold on one second, otherwise my phone will keep ringing. Let me just shut that off. Hold on, I'm sorry.
Just to remind everybody, there was a question what the URL was. It is www.healthtxt.com. And we will be sending some information on that, and there's also some open source free text.
All right, I'm back. Sorry about that. All right, and then one last thing I wanted to say about potential uses is, providing interventions, by phone or text messaging to people who have difficulty making it to the office week to week. So maybe clients who have, significant medical issues, or even parents of clients who can't make it to the office. Or what about, if you work with clients who have severe anxiety or even agoraphobia and aren't quite ready or can't make it to the office, beginning treatment with phone calls, or, people who live in rural areas where, it's a great distance from the program. Phone-based therapy could be a way to provide treatment, or, maybe, have them come in once a week, once a month for face-to-face, and the other weeks do phone treatment. So I think there's a lot of, creative, potential uses to this. I'm sure there's a lot that haven't been thought of, and I'm looking forward to hearing some of your ideas. So like I said, I'd love to hear some of your thoughts about ways that you can use this, for whether it's pre-treatment engagement, prevention, treatment, post-treatment, or engaging family members in treatment, any other uses. So if anyone wants to, speak up or, type in your ideas, and then maybe we can try to walk through a couple and think about how to get started, potential barriers.
So, David, we don't have any questions right now. One of the questions I have is regard to funding and reimbursement. Could you speak a little bit about that?
Sure. So I know that's definitely an area, a big barrier. And as far as for text messaging, I know that that's still being worked out. I haven't heard that any, like insurance reimbursement codes for text message-based intervention. I know there are, I've heard, for phone-based interventions, and I'm not sure at the moment if text messaging could be included under that, but I've heard there are codes, and I can try to find the specific ones for you to support, phone-based work. I think, with grants, sometimes if you have a little bit of extra money to at least get started, to support some of that work, and also I think particularly with like continuing care work or maybe pre-treatment engagement, I don't know if any of your programs use like peer leaders, peer advocates. In our adolescent program, we have a couple of youth who had gone through the program and made great changes, and we hired them on with grant money, and now they do a lot of that kind of work and can do outreach to new clients by phone, things like that as part of their work, so we don't need to reimburse or get insurance reimbursement. But again, I think the more you can just keep it simple, like the interventions we've done, we just bought like a Boost Mobile $30 pay-as-you-go phone, and then we just get the phone cards, and, it doesn't cost much to send text messages. You can keep it locked in your office to, protect confidentiality and not violate HIPAA. And so I'd recommend, if you're getting started, try to just think simple. I think most of the interventions I focused on were really simple, real basic. And I think that's the best way to start, And also, I think just asking your clients, is it something they're really interested in, whether it's focus groups or, client surveys before you go and invest all this time and money into, pursuing one of these interventions. So I know that doesn't completely answer your question, but I think phone-based work, I guess, in summary, can be covered. Text messaging, not yet, but I know they're working on it. And, if you can find grant funding or even donations or, sometimes working with your local, university, they may have an IT department that does some of this work, sometimes pro bono. So
now, we do have a question. We have a question from Jeff Miller, and Jeff will unmute your line, sorry, if you have some additional questions. But Jeff wrote, what information do you provide to clients as part of the consent process prior to engaging clients over mobile devices? Sure.
So the interventions that we've done, I have research study consent forms, but I have language that I can send that kind of, explains the use of cell phones and the steps we take to protect their privacy. So I can send that, and then that can be distributed to all of y'all. Some of the things just to cover, like tips for them about protecting their own confidentiality, like thinking about what they save our name under. I encourage clients, to delete our text as soon as we're done if we have some kind of conversation. Also just, talking to them about the limits of text messaging. For example, I tell clients, no texting high-risk stuff, and you need to call me, and it needs to be during business hours for that. So a lot of the rules are similar to phone calls. In our text messaging, like for reminders, we don't put any identifying information, what kind of appointment it is, who I am, where they're going for the appointment, So I can definitely send you that and give you some tips for just, thinking about how to get started with that.
Jeff, you're unmuted. Did that answer your question, or do you have additional questions?
Hey, Amy, that is exactly what we were looking for in terms of an answer, and what we've been searching for in terms of any protocols or any other information that we can have to assure both protection of our clients as well as protection of our agencies when they're using mobile devices.
Right. And do you all use any mobile devices currently in your agency?
Well, since we contract with about 41 different agencies, it will vary from agency to agency. One of the questions that we have gotten as the county government or main contractor of treatment services has been some help in guidance for all of our agencies in the use of both text as well as cell phones.
Mm-hmm.
Yeah, we've had a lot of concerns about the lack of security of the information, and, in general, cell phones, are not secure communication, so trying to figure out how, what we need to tell people and what, would and wouldn't be permissible both under HIPAA and 42 CFR. So we've been trying to figure out the best way to deal with it.
Right, and we will be having a speaker in another month or so come to talk about that, but we can get some information prior to that call. But there are differences of using sort of kind of a stripped-down phone versus a smartphone when texting. When you use a smartphone with texting, there can be some applications on your phone without your knowledge that can transfer some of that personalized information. But from what I understand, sort of kind of those stripped-down phones that, the old ones we used to use, 7 years ago, that actually a colleague here is holding up, those do not have that same issue. But we will certainly get you some of that information prior to that webinar.
And I can send you all some information. One of the problems is there's not a lot of guidance out there. The presenter for the webinar that you'll attend in a month or two, David Smith, knows this topic about as well as anyone I've spoken to, so I think he can give you much better information. But what he basically told me is that if you really want to be safe, the more conservative, the better. And so if you can buy phones, whether one for each clinician or even just a couple you keep in a space where clinicians can access them, and leaving them locked up at your agency overnight, I think that's one of the best ways to do it. If you're going to use your own phone to do it, then you need to take a little more caution. I know at my hospital, we're a big hospital though, we have an IT department that can encrypt our phones and actually separate, create a space for our professional work and a space for our personal stuff. So I don't know if you have access to that or local IT department at a local university that would be willing to help you with that, but that's also something to consider. Again, there are great software programs that can do all this and large batch of text reminders, but what I've heard from David Smith is they say they're HIPAA compliant, but they're not because government hasn't figured out what that means for texting. Phones are a little different though, and telephone-based continuing care, things like that have been done for, I think longer than these types of text messaging interventions. But I can definitely send you, like I said, some resources that I have.
That would actually be wonderful because we can send that out in a packet all together to our grantees, which I know they'll appreciate that. Sure. Jeff, did you all have any additional comments?
No, that covers it for right now. We're just anxious for more information. I can see our group salivating over the thought of additional protocols and information right now.
Is that David Smith from Yale or a different David Smith?
I think it's a different David. Well, he has worked with Yale before, and he's worked with SAMHSA quite a bit.
Okay, thank you.
Yeah.
Thank you very much.
Is there anybody else that you'd like to, you can hit the raise the hand or type in a question into the chat box that has a question for Chris?
While we're waiting, since I guess no ideas yet about how to use in your programs, I think the most important part is, like I said, just start off slow and do some planning, because your upfront planning is going to save you headaches and time down the road. Like I said, I strongly suggest you talk to your clients first. Focus groups, client satisfaction surveys, whatever it is, and find out, number one, are they even interested in this? And ask them for ideas on how to improve it. I got a lot of great ideas from the teenagers that I work with, like, no, reminders have to be the night before. If it's any earlier, I'll never remember it. What kind of wording to use in the text messages, all that kind of stuff. And then also interventions that, they weren't really interested in. So I definitely suggest starting there. And then I think also just thinking about, what are some of the common barriers to treatment engagement, retention at your program? Thinking about whether cell phones can address any of these issues. Again, think about the interventions we talked about today. You could start today, texting your clients, reminders, or asking them to, remind them to do CBT homework by cell phone or whatever it is. But really think through the potential challenges and barriers, ahead of time as best as you can. And then, obviously, as we've been talking about, really think about how to protect patient privacy. So the last thing I'll say, just, I guess, my conclusions to wrap up, and then, again, if there are any questions. So I think mobile phones can really increase access to treatment. They can, increase engagement, enhance what we're already doing. One of the most important things is that our clinical expertise and the science should drive the technology and not vice versa. I've seen really fancy like iPhone apps that can track all this really cool stuff and they're in-depth, but they're not based on, theory or science or what we know works. So, don't let the technology get ahead of what we already know, basically. A major point for programs, if you have strapped budgets like we do, it doesn't have to be expensive. It doesn't have to be complicated. Pretty much everything I mentioned today you can do with the most basic phone. And so again, start small, and see how it works, see how it goes, and then even if you just start with a handful of clinicians trying to remind, clients of appointments by their own phones, get some data, see how it works, and then try to expand it. Think about feasibility, acceptability, limitations, and last, that it sounds like y'all are interested in it, and I really strongly encourage you to think about ways to do it. All right, so thanks for the time, the interest, and, any more questions, fire away.
Chris, thank you so much. And, the expense things with regard to texting, I recall in a discussion with some community agencies that they actually identified the cost per text to clients. And then they went out and they asked private corporations to support and sponsor the text messaging program. So they were able to provide the corporate sponsor with the total amount it would cost to send maybe 100 text messages to their clients a month. So that's another way you can think about getting this funded.
I'm glad you said that, because I think, foundations especially are a great way to go, to just even get startup money, because again, that's the problem sometimes. But if, for one of our studies, we bought, I think 3 cell phones and, enough, we calculated how many minutes we'd need to send all the text, and, we purchased the cards, and we still have enough right now. So obviously if you're doing it across a large program, it's going to cost a little bit more, but people are interested in this, especially foundations, and, there's definitely money to be found out there. And I've also heard, I guess, SAMHSA has, like technology-based, grants, either out or coming out at some point.
Mm-hmm.
So yeah, funding I think is a great way to go while we're waiting for insurance to start reimbursing this stuff.
Right. And actually next month we will have Dr. David Loveland, who is a Ross grantee and evaluator for 2 of our programs. He is actually he is the PI on a health IT grant that was received by Mississippi, one of our Ross grantees. They applied for a health IT grant and they won that. And he will be on next month to talk about what he is doing with Mississippi with regard to that, which is also very, very interesting. It goes into, Chris, some of the things that you were talking about of, mixing the text messaging with going online and doing CBT training. So I thought that was very interesting. And so we will be sending that information to you within the next couple of weeks.
Okay, great. And one other thing I wanted to add about the cost is, there are research studies, particularly with the text message reminders, showing that the increased revenue from increased attendance more than pays for the text messaging and, increases the money that you make. So, if you can get that upfront money just to get started, depending on what you're doing, it should quickly pay for itself. So that's also something to think about in terms of, long-term sustainability.
Right. And would it be possible for the articles in which you are author, would it be possible for us to receive those and provide those to our grantees?
Yeah, I think that I can do that, and I can also send you, I'll try not to go overboard, but I can send you references for other articles, for some of the stuff we talked about. I see the website that Amy wrote, Health Text. I just wanted to correct that.
I apologize. That's my fault.
No. It's. I did the same thing at JMate. It's so the health part is right, but text it's txts.com.
Oh, okay.
TX. So basically, remove the E and add an S after the last T. Did that make sense?
Oh, no. Add an S.
Here, let me see if I can type this in.
No. TX, yes. No?
X.
Take the E out?
Amy.
Yeah.
He just wrote it in.
Okay. Okay.
Yeah, I was looking at the second
like, that'll be done. Thank you very much. I apologize. That was my fault.
No worries. I just put it to everyone. I figured that out.
Yeah. Okay. Well, thank you so much. Linda, did you have any questions?
No, I thought this was great. I really do appreciate it. I think it's very exciting. I know that there's still a lot of unknowns, but particularly with adolescents, which is a difficult population sometimes to keep engaged, this sounds great. And even, with adults or anybody in treatment or who's in recovery and needs additional support, I think this sounds like a way to go. And I appreciate your flexibility and all the information you have and materials that you're willing to share. So thank you.
Oh, you're welcome. And again, I appreciate the invitation. I appreciate everyone who attended today. And if you have questions, feel free to ask.
We'll be sending out your information so that
okay,
they will
perfect.
be able to contact you should they need to. And just to let you know, this webinar in its entirety will also be posted to the IDS Exchange.
Okay, great.
The material from the last webinar has been posted to our IDS Exchange as well. So I just want to let you all know that. And, we are also trying to get a representative from the e-therapy group to talk to you all about how they're using technology with their peer educators to engage clients on an online platform. So hopefully we'll be able to do that as well. So thank you all so much for joining us today, and we will get this information out to you shortly.
Great. Thanks. Bye.
Take care, everyone.
Bye-bye. Bye.